Head injury is any injury to the scalp, the skull, or the brain. People suffer head injury as a result of a fall from a height, a hit in the head, driving, a dive that might cause a hit in the head. When people suffer head injury, some of the symptoms that you're likely going to see: severe headache, loss of memory, dizziness, they might suffer nausea and vomiting, loss of consciousness, confusion. We might also have a situation where the casualty will start losing blood from the orifices. That is just only as an impact on the head without any visible wound. All we need is to get an ice pack, massage the point of impact in order to reduce the pain and the swollenness of that affected part. When you notice that there is a wound in the scalp, we might need to put pressure in order to stop the bleeding. We put pressure on the spot directly affected this way in order to stop the bleeding. Then, of course, we can equally get our bandage and bandage the whole area. But when we notice that the skull is fractured already, we might not need to put so much pressure on the skull in order not to hurt the brain. The key word here is to loosely tie your bandage. You just put in your pad on that spot where the skull is fractured. Then, of course, you can get your bandage and loosely tie the bandage on that spot where the skull is fractured. At this point, we will make every necessary arrangement to get our casualty as quick as possible to the hospital for further medical attention. So remember, whenever you notice someone with head injury, if it's just an impact on the head without any visible wound, get your ice pack, massage the place with your ice pack to reduce pain and the swollenness of that place. If you notice that it is the scalp that has a wound, you need to apply pressure to stop the bleeding. And of course, if it is skull that is fractured, please loosely tie your bandage in order not to put so much pressure on the brain. With this now, you can now rush your casualty to the hospital as quick as possible. Further medical attention.